Having seen the etiology of pericarditis, let's now look at how the pericarditis is going to present to us clinically. As we have already discussed, if most of the pericarditis is due to viral etiology, you will have a good viral prodrome prior to the onset of symptoms of pericarditis. That is, you will have fever and malaise, maybe even some arthralgia, myalgia. Now, along with that, you will have symptoms that can be ascribed to inflammation of the pericardium itself. Inflammation of the pericardium will produce sharp pricking pain. Of course, it's retrosternal because the heart is located there, the pericardium is located in the retrosternal region. But unlike myocarditis, unlike myocardial infarction, the pain here is sharp. It is sharply localized. That's because the pericardium has a parietal layer which is supplied by A delta type of nerve fibers. Those of you who have forgotten your Gasser and Erlanger classification of nerve fibers, please brush it up, Google it, right? So, A delta, which carries fast pain, confers a sharp nature to the pain of pericarditis, unlike in myocarditis and myocardial infarction. This sharp pain does not radiate to your left arm or to the jaw as you see in myocarditis or myocardial infarction. Instead, it radiates to the area of the trapezius muscle. That's the triangle behind, right? It radiates to the area of the trapezius muscle, and very interestingly, this occurs when the visceral and parietal pericardial layers rub against each other, and naturally, this happens when the patient leans back. As the heart falls backwards, the visceral and parietal layers of pericardium rub against each other with each contraction, and that is what causes this. At the same time, if you lean forward, where the heart remains in the posterior part of the chest wall and the anterior chest wall falls away, there is more space between the visceral and parietal pericardium, and that reduces the pain. So the patient of pericarditis will say that every time I lean back, it hurts a little more. So I prefer to sit leaning a little forward. Okay, this is a classical nature of the pain of acute pericarditis. The clinical signs of pericarditis are usually fever due to the associated viral infection. On examination of the patient, one of the things that will stand out in early pericarditis is on cardiac auscultation. You might be able to hear the sound. Listen carefully to this auscultated sound over the precordium. That sound that you just heard is a pericardial friction rub. Okay, this occurs because the inflamed visceral and parietal pericardium rub against each other during movements of the heart. So it is usually triphasic, three phases that you will hear: the atrial systole, the ventricular systole, and ventricular diastole. Three phases. A triphasic pericardial friction rub is very classical in patients of acute pericarditis. Remember, this happens usually associated with the chest pain when the two layers of pericardium are rubbing against each other. Now, you would be tempted to ask what would happen as more and more fluid accumulates. Yes, the two layers separate away from each other. As the visceral and pericardium move away from each other, they no longer scrape against each other as much. So, the friction rub or the pericardial friction rub disappears as the patient progresses in your ward. And an interesting feature would be that as the fluid fills up in the pericardium, the heart sounds, your classical S1 and S2, will become less and less audible. This is what we call muffling of the heart sounds. So, associated initially, you will get what is called the pericardial friction rub, which is triphasic, as we have described it. And in the late phases, you will have a muffled heart sound. Now, in a great majority of patients of pericarditis, it produces this discomfort of pain, but in a large number of patients, the pericardial fluid disappears as the disease progresses and evolves. So, by the time your viral infection fades off, the fluid also disappears. So, really put, many cases of pericarditis are self limiting. However, there are some well known complications to pericarditis. Okay? The complications of pericarditis include recurrence. One fourth of patients who have pericarditis, especially idiopathic pericarditis, keep having recurrent bouts of pericarditis. So it's a real nuisance for many of these patients. It can become chronic pericardial effusion. Okay? So, we are talking about tuberculosis as a very common cause of chronic pericardial effusion, myxedema, malignancies, sometimes even autoimmune conditions like lupus, rheumatoid arthritis. These are conditions where fluid accumulates around the pericardium, and this, after a period of time, will start compressing the heart. And this compression of the chambers of the heart is called cardiac tamponade. So we shall discuss that in detail. In certain inflammatory conditions, especially tuberculosis, there is a lot of fibrosis as the pericardium heals, and that would make the pericardium tight and constrictive. That's what we call constrictive pericarditis. So remember, even though pericarditis is self-resolving in many patients, there are complications, and you should know what the complications are, and you should be prepared to prevent as well as tackle the complications as they arise. Okay, so with that in mind, we would now go and look further into the investigations of pericarditis and how we manage that.